Welcome to The Real News. Israeli journalist Gideon Levy says that as more and more communities face movement restrictions to slow the spread of the coronavirus, maybe they will get a taste of what Palestinians experience every day living under Israeli military occupation. But for Palestinians, living under restrictions day to day hasn't made it easier to cope with the new, intensified measures to contain COVID-19. Instead, Palestinians are realizing that the combination of occupation and coronavirus is torturous. The Gaza Strip's heavily controlled border offered some protection from the virus until recently, but the first cases of COVID-19 have been diagnosed in the besieged Gaza Strip, and doctors warn of a humanitarian catastrophe in the small, dense areas lacking in medicine and health facilities.
According to what we see on the news about the coronavirus, it is terrifying. We see that the measures taken in China, Italy, and Iran are extreme. Those are big countries, unlike us.
The Palestinian Authority asked the Israeli government to release $11.5 million, which the Israeli government has been withholding. Back in February of 2019, the Israeli government started to deduct money the Palestinian Authority gives to Palestinian prisoners in Israeli jails from the taxes that it collects on behalf of the Palestinian Authority. These prisoners do not receive sufficient food, and the Palestinian Authority must support them, thereby subsidizing the Israeli occupation. The deduction of that money from the authority's budget amounts to nothing short of theft. The Palestinian Authority is now appealing to Israel to release those funds in order to help them deal with the spread of COVID-19, offer treatment to people who become sick, and establish effective quarantine areas. It is, of course, also in the interest of Israel that the Palestinian Authority contain the virus effectively, but the Israeli government refused and continues to hold on to the stolen money. Abdul Nasser Soba, the Gaza director of the World Health Organization, warned about how a lack of resources could exacerbate the pandemic.
Gaza won't be able to deal with the thousands or hundreds of cases, and at that stage we would need to think of something or some response plan that would allow either the transfer of some cases, the difficult cases, or to open resources or hospitals to deal with the virus if it is in hundreds.
Meanwhile, the Israeli government doesn't want the coronavirus outbreak to undermine its efforts to deal with its own housing shortage. Businesses are closed all over Israel, but not construction sites where workers must still show up to work despite the risk of infection and keep on building houses. Most construction workers on those sites are Palestinians coming from the West Bank. Fearing that workers traveling between the West Bank and Israel will accelerate the spread of the disease, Israeli Minister of Defense Naftali Bennett ordered that Palestinian workers must remain in Israel for at least 2 weeks and be separated from their families and social circles if they want to keep their jobs. This creates a serious dilemma for workers. Should they take on a dangerous job at low pay to help provide for their family, who they will not even be allowed to see? Construction worker Ibrahim Abu Safia had trouble breathing, so Israeli employers suspected that he was infected with COVID-19. He was physically thrown out of Israel through the checkpoint and left feverish on the ground without medical help or someone to accompany him. He eventually tested negative for COVID-19. Palestinian Prime Minister Mohammed Shataya made this public announcement.
يوضع كل القادمين من الخارج تحت الحجر الإجباري.
All citizens who return from abroad should be quarantined for 14 days in centers in their cities. Fifth, banks will work in an emergency situation. Bank employees should show their work cards. Sixth, Palestinian workers are not allowed to go to settlements at all. Seventh, we request Israel to provide human conditions for workers who sleep in their workplaces.
There are still over 5,000 Palestinians held as political prisoners in Israeli jails. 4 have recently reported symptoms of infection, and the Israeli secret police interrogator who questioned them was diagnosed with coronavirus. Under these conditions, all Palestinian prisoners are at a very high risk of the disease. Sahar Francis is the director of the Adamir Palestinian Prisoners' Rights Organization and spoke to The Real News.
Actually, the Palestinian prisoners in the Israeli prisons are not well protected from the coronavirus. We have huge concerns about their health. Lately, since 3 weeks, the prison authorities canceled totally the family visits. After that, they canceled as well the whole lawyers' visits into the prisons and interrogation centers, and this makes more concerns because actually these prisoners are totally disconnected from the outside world. They're not able even to phone their families to tell them what's going on with them inside the prison. We fear the huge crowdness inside the prison and the bad health conditions anyway before the coronavirus. And we learned from the prisoners that they didn't get any special hygiene needs or staff to be cleaning their rooms and the facilities they use. And they were not offered special things from the prison authority. The opposite, the prison authority in some prisons, they took some cleaning stuff out of the canteen that they can purchase in their prisons. Those under interrogation, actually, they are also under huge threat. Currently, we know about 4 prisoners under interrogation that they were isolated because they are suspected to be affected by the virus, because one of the workers in the interrogation center in Beit Tikva was analyzed as a patient with the coronavirus.
For the Real News Network, I'm Taya Graham.